you have a Medicare Advantage or a Part D drug plan, every year, by law, you're supposed to get it by September 31st, you will get an annual notice of change letter, which if it's a Medicare Advantage, it's a booklet that's like half an inch thick. And you need to look at it. A lot of people just like, throw it away. You need to look at it. The insurance company is telling you these are what your benefits were this year, and this is how they're going to change for next year. And let me just shortcut it for you. Generally, your benefits get worse, right? I mean, it's hidden in there somewhere. If the monthly cost stays the same, something went up because inflation and medical inflation. So somewhere, something's degraded. You're paying more for something. It might be the cost to go to the ER went from 50 to 75, or the cost for a lab went from 100 to 175. It's in there. You can check side by side and see just how your benefits change, because they do change. Now, there are some plans, some years, that might not change at all. And there's some plans that actually get better from year to year. It's more rare. And you're saying, how could some get better while others get worse? A lot of that is based on how your plan fared last year. So there's a star rating that Medicare gives them from 1 to 5. And if your plan had 5 stars, that means it had the lowest amount of people calling in and complaining about it. People gave really good reviews on the surveys. And there's a whole bunch of other criteria that they have. But if it had more stars than the other plans or than it did last year, your private Medicare Advantage plan gets more money from the government. And if they have more money, they got to spend it on benefits. So your plan could actually get better. You could have better benefits than last year. Like I said, you don't see that much, but that could happen. So when you get your annual notice of change every September, you need to look at it. And if you don't want to do the work comparing it, call us at the Medicare Family and we will explain it to you. Because like I said, sometimes it's tricky. You're trying to figure out what exactly happened in there. The things that are easy are your monthly premium or the deductible on your drug plan. That goes up. But even the deductible on your drug plan is confusing. It's not just one line item. Like you can say last year it was $45 and this year it's $505. No, it's not that simple. The drug deductible might not apply to your generic drugs. It might only apply to tier 2 or 3, or might only apply to tier 4. So even if the deductible went up, it really might not impact you at all. And that's why I said it's always good to just call us at the Medicare Family and let us explain it to you, because it's not as simple on the face of it as it looks. Companies have to give you that notice by law so that you have time during the annual election period, the AEP, to make a choice. And that is from October 15th through December 7th of each year. And I had somebody ask me yesterday, how many times can I change? That's a great question. You could actually change 2 or 3 or 4 times. I mean, it'd be weird. But as many times as you need to during the AEP, the last one that you change before December 7th, that's the one that you will have for all of the next year. So why would you make more than one change? Well, you might have just walked into a Walmart and there was a guy sitting there and you're like, I should just take care of this. And so you just did something. And then you got home and you thought, I don't even know what I did. And I don't know who that guy is. And I went back to Walmart and he wasn't there the next day. So you didn't feel comfortable with your decision? Fine. You can make another change. You can make another change and another change. But your last change, that's the policy you will have for the whole next year on your drug plan and on your Medicare Advantage health insurance plan. So call us at the Medicare Family. We work in all 50 states. You don't pay to have a Medicare specialist. We are independent contractors of over 60 different insurance companies. They pay us, so you don't have to pay extra to have an agent. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.